You know, it's pretty wild to think about, but an estimated 1 in 4 adults all around the world is living with a condition that's silently damaging their liver. It's a massive public health issue, but it often goes completely under the radar until some real harm is done. So let's pull back the curtain on this hidden epidemic and figure out what it all means. So let me just ask you this to get us started. What if this incredibly common yet widely misunderstood liver disease suddenly got a complete name change? I'm talking a total rebrand, decided on by experts from all over the globe. Well, you guessed it. That's exactly what happened. In a really big decision, the medical community has given this condition a whole new identity. And believe me, this change has a huge impact on how we understand and talk about it. That's right. A global group of experts got together and decided to rename what we all used to call non-alcoholic fatty liver disease, or NAFLD. And this wasn't just for kicks. The goal was to create a name that actually points to the disease's root causes and, just as importantly, to get rid of the stigma that came with the old terminology. So here's the breakdown. The broader term, NAFLD, is now called MASLD, which stands for Metabolic Dysfunction Associated Steatotic Liver Disease. Yeah, it's a mouthful. And its more severe inflammatory cousin, once known as NASH, is now MASH. The key change here, the word you really want to pay attention to, is metabolic, and that's a huge clue. To really get why that word metabolic is such a game changer, we have to follow the liver's silent journey. Think of your liver as this super efficient, high-performance factory. In the early stages of MASLD, things just start to slow down. But it all happens so quietly, with absolutely no warning signs. Okay, this shows us exactly how that journey unfolds. It all starts with a perfectly healthy liver. Then we get to stage 2, the start of MSLD, which is called steatosis. That's just a fancy word for fat building up. If that's not dealt with, it can progress to MASH. That's when inflammation joins the party and starts actively damaging liver cells. And the final, most serious stage is cirrhosis, which is severe, permanent scarring that can really mess with your liver's ability to do its job. So, who should be paying attention to this? This is where it gets really interesting. That new name, MSLD, gives it away because it points directly to the root cause, our metabolic health. See, this isn't just a liver problem happening in a vacuum. It's a reflection of what's going on in our entire metabolic system. So, to get an official diagnosis of MASLD, you basically need 2 things. First, proof of fat in your liver, plus at least one of these 5 cardiometabolic risk factors. We're talking about things like a larger waistline, high blood sugar that points to prediabetes or type 2 diabetes, high blood pressure, high levels of a type of fat in your blood called triglycerides, or low levels of that good cholesterol, HDL. Now, we've mentioned this is a silent disease, and that's the fundamental challenge here. Most people have 0 symptoms until a lot of damage has already been done, which makes getting an early and accurate diagnosis so important. So how in the world do we find something that doesn't want to be found? And this is really the core of the problem, isn't it? You can feel perfectly fine on the outside while all this damage is happening on the inside. That's exactly why waiting around for symptoms to show up just isn't a good strategy. We have to be proactive here. Thankfully, we've got some pretty cool tech now, so we don't always need an invasive liver biopsy anymore. We have tools like the FibroScan. It's a quick, totally painless test, takes about 10 minutes, and it uses a special kind of ultrasound to measure both liver stiffness, which tells us about scarring or fibrosis, and the amount of fat buildup. The FibroScan gives us a number called a CAP score to measure the fat. Just think of it like a scale that goes from about 100 to 400. A lower score is better, less fat. A higher score, like this 350 you see here, well, that points to a significant amount of fat in the liver. It's a simple number, but it tells us a whole lot about what's going on. Okay, so a diagnosis has been made. The next logical question is, now what? Well, the good news is that for many people, the damage isn't permanent. There is a clear path forward to manage and, in a lot of cases, even reverse the condition. The single most powerful weapon we have against fatty liver disease is lifestyle modification. I mean it. Diet and exercise are the absolute cornerstones of treatment. Research shows that losing just 7 to 10% of your body weight can dramatically, and I mean dramatically, reduce liver fat and inflammation. Now, for some people with MASH, that more advanced inflammatory form, medication can be an option. A major study called the PIVENS trial looked at a couple of possibilities. It found that vitamin E could improve the overall health of the liver in patients who don't have diabetes. Another drug, pioglitazone, didn't actually reduce the scarring that was already there, but it did help with other important things, like cutting down on inflammation and fat. And this brings us to our final and maybe the most important question. Knowing that millions upon millions of people are living with this condition without even realizing it, how do we shift from silent damage to proactive health? How do we finally turn the tide on this silent epidemic?